Hey folks, I appreciate you being with me today on the Transplant Helper. My name is Jim Burl. As you can probably see in my background here, I'm not exactly in my typical environment. As a matter of fact, I'm away in a hotel, so I'm not in my office. I'm not in my studio, if you will. So if the sound is a little different, the lighting is off, or you hear my neighbor's television, I apologize for that. But hopefully the content will be right where you expect it to be. And for me, that would be to fulfill my goal to advocate, educate, and motivate you as a transplant patient. Now, for today, I want to discuss with you a phrase that I use oftentimes on this program, and I use it all the time when I'm meeting face-to-face with fellow patients, and that is that transplant is a treatment, not a cure. That's a quote I've been using for many, many years. I take from one of my cardiologists from about 10 years ago, and I like to use it to help people out and to give them some information. But sometimes when I use that phrase, they look back into my eyes when we're face-to-face, at least, like they don't really understand. So I like to explain to them the same way I'm going to explain to you. Now, let me use an illustration to help us to better understand this. Let's imagine for a moment you've been having a lot of stomach problems, a lot of intestinal difficulties, if you will, and that at some point a doctor tells you, Jim, I think we need to take out your gallbladder. So they schedule that for the following week. You go and you have that done, maybe a one-day surgery, you're out. 2 or 3 weeks later, you're fully recovered. And there's one thing that's certain about your life right now and for the rest of your life, and that is regardless of the problems that you have, your gallbladder will never be one of them. You know, it's gone, it's been removed, so no matter what occurs later, they'll never be able to say, Jim, I think it's your gallbladder. Your gallbladder's gone. Well, we understand that. So we understand that removing the gallbladder is a cure to gallbladder troubles, or removing your tonsils typically is a cure to tonsil troubles, or your appendix, or whatever. And there's a lot of things in the medical life that are like that. They do this, and that's the end result, and that's it. It's all that need to be done. There's no looking back. It's a one and done. That's not the case with transplant. When we're living the transplant life, even though we get a new opportunity at life, even though things can be much better, we'll be healthier, there's a lot that's great about the transplant life. On the other side, we also have to keep in our frame of minds that it was and is a treatment, not a cure. That is, there's always going to be more appointments to go to. There's always going to be more medications to take. There may even potentially be more procedures that need to be done in follow-up or in years to follow, and we just have to be ready for that. Now, I don't mean that to be negative, and I certainly, when I tell people that, especially face-to-face, I don't mean to discourage them. I want to encourage them, but to do it through letting them know that this is what life really is, to letting them know in the front of things, on the onset, this is what to expect. I think one of the things that have helped me so much in this transplant life that I live, and I'm trying to share with you too, is that when we have knowledge, we have power. When we have knowledge, we have expectations. And when we have expectations, we have hope. And so hopefully that's what this is doing for you, because it's what it's done for me. Knowing that transplant is a treatment, not a cure, actually gives me hope. It gives me the hope of knowing that when I hit bumps in the road, I hit highs and lows, good days, bad days, I can always just package that up and roll it up in a ball to say, Jim, this is a part of it. This is a part of what you're living with. It's not a cure, but it's certainly a treatment. And I'll tell you, I think it's a good treatment. So if you're pre-transplant right now and you're facing the future, just know that. Know this is not the end-all, be-all of everything, but know it is your best option. If you're post-transplant, you probably already comprehended this. You probably already knew this. You're thinking, Jim, you ain't telling me nothing. That's fine too. But keep it in mind and try to share it with others so that they can live the best life they can. I appreciate you joining me today. If this program, like any of my others, have helped you in any way, how about like, subscribe, and share? And please always continue to come back for new content. I'm trying to offer that to you 2 or 3 or 4 times a week whenever possible. And by subscribing, obviously you get access to that very quickly. Let me offer something else to you also. If you've not already liked my page, The Transplant Helper, that's The Transplant Helper on Facebook, how about go ahead over and do that, because I'm going to continue to offer my programs there as well as wherever you found it, here on YouTube, what have you. But I'm also going to be in the near future offering some live streams where I sit down in front of the camera and just communicate with you in real time, answer questions, have discussions, just try to continue to build this community. So going over to the Facebook page, The Transplant Helper, and give me a thumbs up, a like to that, so that you can be connected with me in that way. And if you have anything you want to connect with me there, you can hit the messenger button, send me a message. I'll be happy to answer your question any way that I can. But anyway, thank you so much for watching tonight. And until next time, stay stronger, friends.